how is this new bill going to help in the short term when we have a shortage of healthcare professionals?
Quebec's new plan to reform the healthcare system is drawing some backlash and mixed reactions. Bill 15 was tabled Wednesday and aims to create Santé Québec, an agency responsible for coordinating the day-to-day operations of the health and social services network. The health minister says a more organized structure at the top will lead to reduced wait times in emergency rooms and surgeries and improve the overall patient experience.
Every time we have a new health minister, there's like this need to prove themselves. And the only way to do it is to demonstrate that we need a new reform. Rather than to fix things that are not working currently, their solution is always to shake the structure, create a new reform, a new structure.
The Santé Québec agency would turn regional health agencies, CIS and CIUS, into councils that answer to them and monitor how effective services are and be the sole employer for all healthcare workers. And just 4 collective agreements would exist.
Maybe it will bring back a bit more focused attention and awareness of what's going on in immediate communities, because the previous healthcare reform, it didn't centralize care. It actually polarized it, because you created these big CISs and CUSs, these great territorial monsters, with the leadership at one end close to some facilities, but completely away from the other ends where they're not connecting to their communities or knowing what's going on.
On Thursday, the opposition critiqued the plan, accusing the health ministry of reducing its responsibility. The premier says those parties want to maintain the status quo. What we're trying to do is give the capacity locally, with a manager in each establishment, to make the scheduling where they can better share the resources. It will help the quality of life of nurses and improve services. I call this decentralization. The bill, if law, would also create a position of a National Complaints Commissioner, and a National Patients Committee will be set up.
As long as the local hospitals and centers have some kind of patient committee, that's important. But I think at that provincial level, at that higher level, yes, those patient committees do need oversight. But that oversight should be done by patients themselves with knowledge.
But some say the only way to keep things afloat is by attracting and retaining staff.
You have to make sure that the new cohorts that are studying in nursing, that are graduating, that they find their place, that they feel that there's a sense of belonging within the healthcare in the province of Quebec, so that we retain these new cohorts and that they don't leave the province.
In Montreal, Alyssia Rubertucci, City News.